Hey there, welcome to the Thriving in Wellness podcast with Haley and Caitlin. This podcast is for women who are tired of just surviving and ready to truly thrive. It's time to reclaim your health and build trust in your body.
Join us as we myth-bust nutrition topics, tackle your mindset, and dive into the nerdy side of women's health. Just a reminder that this is meant for educational purposes only and is not meant to be used for medical diagnosis or treatment. Now let's jump in. Hello, and welcome back to the Thriving in Wellness podcast. We are so happy to be starting season 3 with you guys. And this season, we're going to be really focusing on the other contributors to our health in addition to food. So as dietitians, we talk so much about how different foods and specific nutrients is impacting our health. But we want to talk about all of the other things other than just food. So today we're going to be talking about minerals. So of course this is, we can get some of our minerals from food, but we're going to be talking a lot about minerals in the context of hydration, because obviously that can impact our health significantly. So Haley, will you kind of define what we mean by minerals? Because how we talk about them versus what other people think sometimes is a little bit different.
Yeah, so when we're referring to minerals, we will mainly be talking about the macro minerals, and we'll explore what those are a little bit more in depth, but that's going to be like sodium, potassium, magnesium, calcium. Of course, we'll look at iron and things like that, because all of those play a crucial role in our metabolic health, every function on our body, basically. And so those are kind of like our macro minerals, but we also have our micro minerals or our trace minerals. Those are going to be things like selenium, manganese, things like that aren't talked about quite as much, which are also very, very important. But in this episode, we will be focusing more on the macro minerals because, with macro, if you're not familiar with that, that means we need more of them too, right? We need more in our diet and with hydration. And so a lot of times these are referred to as like electrolytes. So these are all electrolytes here with the magnesium and everything. So we'll be diving into that a bit more. And this is something you and we've talked about on other episodes. Like we test a lot with our clients because it's so crucial to our overall health. And for our clientele, these women that we're working with, moms, busy working women, we see a lot of women are depleted in minerals, and that can impact your overall health, energy levels, and hydration. So one thing you and I were talking about too is that when we bring this up with people, we often hear the comments like, oh, yeah, I'm good. I drink like the mineral water from the store. I drink smart water, or I add minerals to my water. What's your response to that when people are like, oh, I'm good with my minerals because I do that?
Yeah, so first I always point out, like, it's great that you're doing that. Like, that's not a bad thing. And just because they're micro minerals doesn't mean that we don't need them. We just need them in much smaller amounts
Mm-hmm.
than the macro minerals. Um, but I want to point out that um, the macro minerals like the sodium and potassium tend to be kind of the first hitters that I'm talking about in context of like drinking water.
Mm-hmm.
And that tends to be like when it comes up in the conversation. And so I always phrase it as, does your water taste salty? And they're like, oh, no, I can't taste anything. And I'm like, okay, then those are the trace minerals,
Yeah.
which is great. Now we know that we have those covered. Now we need to add in the sodium and potassium. Obviously not for everybody, but these key people that you and I both work with so much, these overworked women,
Yes.
Whether from your job or your life or even just like your mental state around things and probably all the stuff you'll hear about throughout the rest of this season, but all of those other pieces that are depleting our bodies of those minerals. um, and so that's kind of my question of like, if it's not tasting salty, then we're not getting enough of the electrolytes
Mhm.
that we're needing.
Yeah, and well, I'm sure people are like, salty water, like adding sodium. There might be a few of you freaking out there, so we're gonna dive into that. And one thing I wanted to say here too is that I I get the question sometimes too, like, why do we need to remineralize our water? But for most people, like you're using water filters or an RO system or something, and that's stripping our water of all these fantastic trace minerals. So that is a great, like, it's great that you're adding those back in. So that can really help. But again, for a lot of our women that we see, they're at the point that it's not just maintenance. It's like we gotta fix a insufficiency or depletion, right? We need to do a little bit more before we can be at maintenance. And food is a huge part of that, especially with the macro minerals. Like we need to address food to be able to get more of those in. But oftentimes we're using like mineral mocktails or adding electrolytes to our water to make sure that we're really bumping it up and again optimizing that hydration. So we didn't I don't know if we really planned this out to talk about it, but why how does how do those electrolytes really help with the hydration piece? Because I know there's so much we could say about minerals, and I'm trying to not get off track and stay more on the hydration piece.
Yeah. So yes, I wanted to point out that like one of the ways that I like very quickly assess if somebody's really needing a lot of the sodium and potassium added to their water. I talk a lot about how frequently somebody's going
Yeah.
pee. So like, yes, going to the bathroom, but like not talking about poop today.
If you feel like the water's going straight through you.
Yes. And I'll have people that are like, "Oh yeah, I'm constantly going to the bathroom like every hour." And they're like, "Oh, it's just a nice break to like get up from work." Or the flip side of like, I don't want to drink any more water because I'm constantly running to the bathroom. And that is a huge sign that you're like, we need the sodium and potassium for the water to hold on to get into our body. And so if it's going straight through you, then one, you're not retaining any of that water. And two, you could be flushing out even more of those minerals. So that's how I initially like assess how significantly somebody needs this extra support. But then it's a great way to measure progress because I mean everybody's different. And so then I'm like, okay, let's start here with, one mineral mocktail a day. But for some people, they're like, okay, I went from going to the bathroom every like 30 minutes to now I'm going every hour. So then it's like, okay, cool, we're making progress, but we still need to bump that up a little bit more. And so then they can like tell in their own body, that they're making progress.
I just want to point out if you hear that noise in the background, I tried to mute myself, but I think it's fitting. My dogs keep drinking water that's right next to me, so they're working on staying hydrated while we talk about this.
That's
My
awesome.
female dog is really good about that. I feel like she's like a camel. She drinks so much water. Maybe she needs some more minerals. But I think I love all your points there too. And one way I've heard it described, my mentor, when she taught me a lot about minerals, because unfortunately, I don't feel like we learned a lot in school about this. Like, sure, we went through like all these nutrients and everything, but we didn't really talk about how crucial they are or how prevalent it is for people to be deficient in or not having enough in their diet. Um, so one way it's described too is like with the hydration piece, if it's just constantly going through you, ideally we want our cells to be nice and plump and hydrated. So think of a nice, like plump, crispy grape versus a raisin, right? And if we're just drinking that water that doesn't have the minerals like the sodium, potassium, and all that to work to get the water into the cells, it's just going through us and we still have these raisins. We don't want that. Maybe just some soggy raisins, but we want our cells to be nice plump grapes. So we need those minerals to get that in there. Uh,
Mm.
and we're also not saying like all your water should just be electrolytes and mineral mocktails. The importance is that you have enough available in your system for your body to utilize it to get that hydration, that true hydration. And I know we're going to talk about like some myths and stuff about this at the end, but I think it's a good time to talk about like breaking down the macro minerals a bit more. So let's do the sodium, potassium, magnesium, calcium. And I think we start with the biggie, sodium. Like in school, I probably never would have expected. I feel like our professors are probably like, if they saw what we post sometimes about sodium, they're rolling their eyes and can't believe what they're seeing. If we're recommending people add sodium to their diet because we were all taught like low sodium's the way to go, always cut salt out. So let's break that down a little bit.
Yeah, well, th- I I mean, I was the same way when I started getting into more of the functional medicine world. I was like, wait, this much sodium?
Right?
I feel like the biggest thing that I've recognized is while yes, there are times when we have significantly higher needs because we're burning through more, whether from stress or pregnancy, breastfeeding.
Mhm.
Um, I find so many of my patients come to me on such a good diet, like not a lot of processed foods. They're
Yeah.
eating very healthy and they just naturally don't add a lot of salt to their foods. And so then their diet is very low in sodium. And I have like porn through the research to try to identify, even for people that maybe have higher blood pressure, like what what the sodium recommendations really are. And there is a point, it's like a bell curve
Yeah.
where you can have too little sodium and it's going to cause higher blood pressure. And when you're eating a really unprocessed diet, I don't want to say clean, but like whole foods, there's just not a lot of sodium naturally in those foods. And so then like it totally swings to that other end. Um, yeah.
I think a lot of people don't recognize that because the fear with sodium really grew from like the standard American diet where we're getting it from all these processed food or fast food and all this. And sodium can add up quickly. So if you're eating that kind of diet, maybe we want to think about like adding salt to your water, right? But again, we're talking about who we normally work with. And it's these women who are trying their hardest to eat really well. They're eating whole foods. There's this, and I think it's a good point that you brought up the blood pressure and sodium because that's a big piece of what we're taught, right? Is the blood pressure piece. And research now shows like not everyone with high blood pressure is impacted by the sodium either, right? It's like 50% of the people with hypertension.
Right.
Um, and it's really interesting, like for some people, it might actually be like, for most people, I would say it's probably an imbalance, right? It's because with the standard American diet, usually sodium is so high and potassium so low. And so
Mhm.
that's where the issue lies is with these minerals, we really want to find an overall balance here because they're not working alone, they're working together. And so if we have way too much of one and not enough another, that's where issues can come up too. And there's a patient I used to have at the clinic I worked with, and when I was working there, like it was a sorry, very conventionally minded clinic. So I was kind of getting into the functional medicine space. And so that was challenging for me because you had to be careful with what you can recommend there, just based on the doctor. Anyways, I had this patient who had congestive heart failure. So there's definitely conditions like with heart disease and renal disease. Like we need to be cautious of our minerals, right? So we're not talking to those people right now. But with this patient particularly, like she had type 1 diabetes, and it was really interesting to see as soon as her doctors recommended this low sodium diet, like very, very low sodium diet, like 1,000 milligrams. She started to retain water like crazy, and her blood sugar went through the roof. And she's like, no matter what I do, I can't. I can't get it under control. And so that's when I started to dive into the research of how does sodium and our minerals like impact our blood sugar regulation too. And
Mhm.
spoiler alert, it plays a big part in that.
Yeah. Yeah. So fascinating. And I love that you brought up, and I know we're going to talk about it later, but that balance between sodium and potassium, because
Mhm.
that's another piece with high blood pressure where it's like you for lots of people, it's like how much less can they reduce their sodium?
Mhm.
Like for the people who are already cutting out a lot of the processed foods. And so if we can enjoy our food with a little bit of salt on there, but then increase our potassium, that seems like a way more enjoyable way to go about it rather than just cutting out all of the sodium.
100%. And we need sodium for other things too, right? We're focused on hydration today. So all like our electrolytes, including the sodium, help with that hydration, but it also plays a part in stomach acid production, right? And all these other things that if we restrict too much, again, with that bell curve, like too high isn't ideal either. But if we restrict too much, that can lead to all these other issues too. So it's a balancing act for sure, and we probably sound like broken records saying that with everything, but, let's was there anything else that you wanted to say about sodium?
No, I think that's good. We can move on to potassium.
All right, perfect. So potassium, I feel like magnesium used to be my favorite mineral until I like learned more, and I want to say potassium is probably my favorite right now. If you have a favorite mineral, just because like my background with thyroid issues and all the women that I see with thyroid concerns, I feel like for a lot of women, potassium is a missing link
Mhm.
because potassium, again, is so important for so many things. Um, but it plays a big part in blood sugar regulation, and thyroid health. So it's not talked a lot about, again, in the more of the conventional space with thyroid, because it's like, oh, you're put on levothyroxine, which is T4. Um, one, we need to, I don't want to go into a thyroid episode here, but basically we need to get that thyroid into the cell, thyroid hormone into the cell, right? And potassium is a crucial mineral to be able to do that. And so you might be taking the right amount of medication and doing all the right things, but if your potassium levels are inadequate, then you might still be feeling sluggish. You might still be struggling a bit. And so that's why this mineral, I've seen it firsthand, can be such a game changer. And you get it from a lot of delicious foods. So there's a bonus there.
Yes, I love when people are like, "Oh, you want me to have more bananas and potatoes? I love
Right?
those foods."
Like foods that they're like, they've been told they can't touch because they're too high in sugar and they're
Yes.
quote unquote white foods. I hate that.
All right. I also love potassium. It is one of my favorites, but anything else that we wanted to talk about with
I
that?
don't think so. Again, I could dive more into like the food aspect, and I'm trying to, that's challenging for us to not talk about the food piece. So I think magnesium, we can move
Yeah.
on to magnesium. So I'll let you take the lead on this one.
Yeah. I feel like magnesium is in the limelight. Lots
Has
of
been
people
for a
know about
while too.
magnesium, they're taking it, which is great. It's so needed. And it's often one of those like first things that I'll recommend for somebody if they're having like difficulty sleeping or struggling with constipation. And it's like a pretty quick fix
Hmm.
uh, for like some of those ailments. Um, but we burn through so much magnesium when we are stressed that I almost like laugh at the like RDA, so like the like basic recommendations for magnesium for what our needs are, because they're relatively low in comparison to what I'm finding a lot of my patients needing to like I mean, the biggest piece is that like we're trying to like rebuild up their stores. And so
Yeah.
then they're like, oh, well, I get enough magnesium from foods, or like I'll just eat more of those foods. And I'm like, you can, but to like fully build it up and get back to what you need with the stress levels that you have, it's just not enough. And we always, touch on the piece of like, we have to work on managing our stress. And I think there's going to be some really great episodes this season on different ways that stress may present in our life, and how we can manage that. But we do live in like a go, go, go lifestyle. And so there are going to be a lot of those stressors there that's going to deplete magnesium. The other piece that I love to talk about, because vitamin D used to be, and still is a little bit, but used to be kind of that like flashy
Yeah.
vitamin. Um, so I still see a lot of people taking really high doses of like supplemental vitamin D, but our body needs magnesium to help convert that within our body. And so if you're taking a really high dose of vitamin D, um, and not taking magnesium, either your vitamin D level isn't going to increase as well as you want and need it to, but then your body is just burning through even more of that magnesium.
Yeah, and I think that goes along well with the calcium, but a couple other things I want to say about the magnesium piece is, or like the vitamin D piece that you said. I was just talking to a client about this the other day, is I still see doctors or clinicians recommending that mega dose of vitamin D2, like the 50,000 once a week. And I've
Yep.
worked with people where they were taking that for years consistently and not seeing their
Whoa.
vitamin D go up. And yeah, so it was nutty. And then like it was when I was in the clinic. Obviously now I'd recommend something different if I saw that. So now
Yeah.
I was the reason I was talking to my client was about it. It's like, hey, you're welcome to take that. But she's like, I've done research too. I think the D3 is better. And then we talked about the magnesium relationship and everything. So there's more to it. Right. And then also, okay, Nolly wants to be a part of this episode. So everyone say hi if you're watching. So the magnesium piece. Also, I know you recommended or said like that's one of the first lines that you often recommend to people with certain things. And same goes for me. However, I have seen a small group of people where it ends up backfiring. Like they actually don't feel better with magnesium.
Mm.
And that was always confusing to me because I was like,
Yep.
why? Like you need this. You clearly are depleted in magnesium. What's going on?
Yeah.
And so again, as I started to learn more about the minerals, they all work together. And I realized or I learned that for some people, if you're significantly depleted in sodium and potassium or one of those, then we need to address that first, get those up, and then we can add in the magnesium. Because if
Mhm.
we start to mega dose that magnesium and that ramps up the adrenals and all that, then we're just going to lead ourselves further into depletion with the sodium potassium.
Yes. Um, okay, let's touch more on calcium. Do you want to dive into that a little bit?
Sure. When you were talking about vitamin D, like it was having its heyday or whatever, I think calcium has been recommended for years and years and years. Like this is something that I don't think is going away. Um,
Mhm.
so I always see like vitamin D, calcium supplements that people are taking. And I actually don't typically recommend supplementing with calcium. Sure, there's always a subset of people where it's probably appropriate. But again, we don't want to supplement with that and bring our calcium levels up really significantly, especially if our potassium levels are down, because that's going to lead to more thyroid issues because too much calcium can actually block that thyroid hormone. So we definitely don't want to be blindly supplementing with this. So if you are someone who was recommended to supplement with calcium, whether it just because of your age or another reason, I definitely recommend to monitor that. Sure,
Mhm.
blood test is one way, but I think we've talked about this on other episodes. Like blood tests aren't the best strategy for mineral testing just because our body so tightly regulates those. It doesn't really tell us what the stores are like in the rest of our body. So the HTMA test is something that you could use for the calcium because that's actually looking at your calcium levels in your tissue. What's your storage built up like? And so if you've been blindly supplementing for years and years, you might have plenty of calcium.
Mhm.
So if you're still having like issues with bones or it's not in the blood or something, then we need to look further and say like, okay, something else is going on here. Why is that? So yeah, nutrients do not work in a silo. Same goes with like these minerals, they don't work alone, they work together. So I'm talking about this with calcium, but with really all of them, we don't want to just supplement one without thinking about the other. And we don't want to just like supplement for years and years and years without monitoring that and making sure that we're not throwing things out of whack.
Yep. Um, I did want to point out this is like kind of jumping back to particularly like potassium and our high blood pressure conversation a little bit. Um, but just remember, obviously, when we're not giving medical advice here, but make sure that you're being really careful with your medications if you are wanting to consider supplementing with some electrolytes, especially if you have high blood pressure, because there are some high blood pressure medications that are potassium sparing. And so then you can get too high of level of potassium. And that's always such a challenge for me when I'm working with somebody who has high blood pressure, because it's like, well, they're we really have to go from a food standpoint,
Mhm.
and not be using a bunch of like electrolyte like powders and supplements and things, because then it can go overboard.
Yeah, and everyone's a little bit different too with that, and that's why monitoring and testing can always be beneficial. Like, for example, my husband's been he's for some weird reason has high blood pressure. I think it's just his nervous system is just constantly jacked up. Anyways, he's been on a few of those medications that are potassium sparing, and so he's monitored that pretty closely, and he's never had an issue despite supplementing. So everyone's a little bit different. It
Mhm.
really depends on how much your body's utilizing it and everything. But I think with any time you're on a medication, we always recommend like discussing it with your provider. If you're working with a dietitian, you could always bring it up with them. If they want you to discuss it with your doctor or medical provider, they should be recommending that as well. But yeah, we always put that caution in there. And again, with those medical conditions too that I mentioned earlier. Okay, I want to wrap up with a myth. I think we touched on this already, but I think this is more so in like the fitness world and everything. But um, either with fitness world and then diet world. So like one being like, let's drink a ton of water throughout the day, like gallon plus of water. And that's where
Mhm.
we can start to deplete things. And another thing too is drinking a bunch of water before your meal to help you feel full, to help with satiety and everything. So what are your thoughts on that?
So I want to touch on the particularly the one during mealtime, since I do so much gut health work and it's what I see. So the problem with like the reason we don't recommend that people drink water, a ton of water while they're eating, is because it can dilute your stomach acid, and
Mhm.
we need our stomach acid to break down and digest our food. So people who come in with, like bloating or even just like that, like almost like brick feeling in your stomach after you eat. Sometimes I'm talking to them and they're like, oh yeah, like I've been trying to lose weight. And so before my meals, I drink 16 ounces of water before every single meal. And so it's diluting that and then leading to all of those symptoms. So like drinking little sips of water like to your thirst during your meal is no problem. It's not like you have to avoid drinking, but yeah, it's when it gets to that excessive point.
Yeah, and think about what if you're already low in sodium and that's leading to already a poor production of stomach acid, or maybe you have some infection or something like H. pylori that's impacting that. And then you're just kind of adding fuel to that fire. And so a simple shift could be really helpful like that. So yes, there's plenty of other ways that we recommend helping with satiety other than just like tricking yourself. Overall hydration in general will help with that. So not necessarily just at mealtime, but if you're hydrated throughout the day, that could definitely help with hunger regulation too. So,
Right. And the ideal way to be well hydrated is to sip on water throughout the day and never to be just chugging water, whether it's with meals or outside of meals.
100%. All right, anything else you want to add?
No, I think we need to wrap this up.
Okay, perfect. All right. So I think it's impossible for us to never bring up food. So obviously we touched on that a little bit when it comes to minerals. But upcoming episodes, we have some fantastic guests this season, and I'm really excited for you to hear everything that they have to say. Everything from like relationships and trauma and oral health. Like we're talking about a lot of different things this season. So I'm pretty excited about it. Um, so, as always, if you have any questions or any maybe topics you want to hear a little bit more about, feel free to reach out to us on Instagram at dietitian Caitlin or dietitian Haley, and we'd love to hear from you. And I'll see you next week.
All right, bye.